Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Side effects of nitrates. The side effects of nitrates are nitrates will result in pulsatile headache is seen. The pulsatile headache is mainly increased in the Monday. So it is called as Monday's disease. Why is it increased in the Monday? Because the patient actually nitrate toxicity or side effects are seen in patients who work in industries where nitrates are released. So when the patient goes into the industry, he inhales this nitrate gas every day, almost every day, all the 7 days a week, all the 6 days a week, because Sunday is a holiday. So he inhales nitrates all the 6 days a week, so he does not get any headache in these 6 days because of the tolerance. Then on the seventh day, that is on Sunday, Sunday is a holiday, so the patient does not go to his work, so he does not inhale nitrates. So as a result, when the patient goes to the work on Monday, because on the Sunday there is no activation of receptors by the nitrates, so the tolerance is decreased. So once the patient goes into his work on Monday, then again he inhales the nitrates. So now these nitrates will act on the receptors, thus causing pulsatile headache. So this is Monday's disease. So this nitrates will also increase the intracranial pressure or intraocular tension, though not they will do only minimally, ma- not to a maximum extent, because the nitrate will cause vasodilatation. There occurs pooling of the blood in the venous system, thus causing hypotension. Because there is hypotension, reflexly the sympathetic system gets activated, thus resulting in reflex tachycardia is seen. The patient will also present with fluid retention, and pedal edema is also seen, and gastroesophageal reflex disease is also seen in the patient suffering uh, taking nitrates, because nitrates are vasodilators. So because they are vasodilators, they cause dilatation and relaxation of the smooth muscles. So as a result, they relax the smooth muscles of the physiological esophageal sphincter, that is lower esophageal sphincter. When nitrates relax the lower esophageal sphincter, the food from the stomach goes back into the esophagus, thus resulting in gastroesophageal reflex disease. Nitrates can also cause constipation, because of the um, relaxation of the gastric sorry relaxation of the intestinal smooth muscles will decrease the peristalsis, and as a result it causes constipation. Nitrates can cause methemoglobinemia. So these nitrates will combine with the hemoglobin, resulting in methemoglobinemia, which is a side effect. Nitrates will also increase the formation of cerebrospinal fluid and the aqueous humor. And the one important thing is that tolerance is seen in nitrates, and dependence is also seen in nitrates. That is, what is dependence? If the patient is using nitrates for a long period of time, and if he suddenly withdraws the nitrates, then this sudden withdrawal of the nitrates will result in development of angina again. Once he stops the nitrates, suddenly he starts developing angina again. So this is called as rebound angina, which is seen due to the withdrawal of nitrates. So the patient develops dependence to the nitrates. So tolerance. So there is one drug which does not show tolerance. Actually, the drug molsidomine is a newer drug which does not show any tolerance to the nitrates.
thank you and thank you for watching.